Hi, I'm Dr. Bill Adams, and you're watching the Plastic Surgery Channel. Last year, more than 350,000 women decided to get breast augmentation.
It helped me understand what my body would be like after the surgery.
And speaking of hard fats, let's talk about your olfactory organ.
So a prospective patient, when they're looking to have surgery, must always understand that every single surgical procedure has its import, and they must be concerned with the quality that's being delivered to them.
Recent statistics suggest that heart disease is not limited to old age, especially if you're obese. A new study in the Journal of Clinical Endocrinology and Metabolism finds that children who are diagnosed as obese are more likely to have cardiovascular problems as they get older, and this is even before they're diagnosed with metabolic syndrome. Lead researcher Dr. Nellie Morris said the consequences of having too much body fat start early and can cause abnormalities in the blood that predispose some kids to cardiovascular disease. These include early markers of inflammation and blood clotting, which can later lead to a heart attack or stroke. The study ties to a new report from federal health officials concerning heart disease among older kids. A national survey of blood test results from adolescents ages 12 to 19 showed that 1 in 5 has a cholesterol level high enough to be a cardiovascular risk. Linda Van Horn, professor of preventative medicine at Northwestern University and head of the American Heart Association's Nutrition Committee, told the Washington Post, quote, "This is the future of America," noting that the statistics are an urgent call for families and healthcare providers to get serious about the problem of childhood obesity. Now let's check in with the one and only bariatric girl, the lovely Miss Yvonne McCarthy, to see what she's turned up in the world of weight loss surgery on the World Wide Web.
Hey guys, Yvonne McCarthy with the Weight Loss Surgery Channel. Recently I was introduced to a site called Your Personal Lap Band Guide. The site was created by Suzette Kroll, a gastric lap band nutritionist. Suzette specializes in weight loss, bariatric nutrition, weight loss surgery, sports nutrition, vegetarianism, teen eating, and nutrition relating to heart disease and diabetes. Suzette says, "You see, success is not as simple as merely having the gastric banding procedure. Your ultimate outcome, how much you end up weighing, depends largely upon how committed and motivated you are to following the diet and exercise guidelines post-surgery." Now, I know we are not all gastric band patients, but she has much to offer in the nutritional field, like food journals, fun stuff, recipes, and product reviews. I feel like we can all learn from each other, and Suzette's commitment to helping is really obvious by taking a look at her site. I know I found myself as a gastric bypass post-op having a close friend getting lap band that I needed to know more about it so I could be supportive and informed. So stop by Your Personal Lap Band Guide and learn a thing or two about nutrition or recipes or fun stuff. Education is always helpful, and I think you'll find Suzette knows her business. I'm Yvonne McCarthy, and I'll see you next week on WLS on the World Wide Web. Bye!
Yvonne is a sweetheart. She's an awesome person, an awesome inspiration to us all.
Yvonne does not just talk the talk, she walks the walk about what's important in life and what she thinks changes for people.
Yvonne is so positive that she makes me want to be a better me.